Here at the Hart Senate office building just outside the Capitol, Senator Bernie Sanders, Senator Kamala Harris, Cory Booker, Elizabeth Warren, Mazie Hirono, and a number of other Democratic senators joined together to unveil the Medicare for All Act of 2017.
Today, all of us stand before you and proudly proclaim our belief that health care in America must be a right, not a privilege.
Normally at these Capitol Hill events, the setting tends to drain all the life out of the anecdotes from the regular people because they kind of look like props. And then when they tell the sad story, it doesn't have the punch because of it almost seems like it's theater. But one woman who came up today carrying her young child told a story about choosing between health care for herself and for her child that had a gut punch of an ending to it.
My daughter Charlie was delivered via emergency C-section 10 hours into her 26th week of gestation. She weighed 1 pound, 12 ounces, and was the size of my hand. My constant NICU bedside vigil started because I did not want her to die alone. She responded positively to therapy. OT gave her the use of her hands. It's a good thing because she wants to be a doctor and a drummer. PT made it possible for her to run and jump, as you guys have all witnessed. And speech therapy is why she can talk and say, "Mommy, I love you." However, all of it came at a cost. I had to make impossible choices. One day, I needed an expensive dental procedure. Unfortunately, it was at the same time a therapy payment was due. Charlie's speech was emerging. I was afraid we would miss a window of opportunity in her development if we cut therapy. I chose to pay her therapy payment and put off my dental procedure. Due to the delay, an infection spread throughout my mouth and jaw. I went to the emergency department because the swelling in my mouth obstructed my airway. The next day, I had all of my teeth pulled, the infection drained, and parts of my jaw scraped away in a 6-hour procedure under local anesthesia. I could not afford to have it done under general anesthesia. I cried the entire ride home afterwards. Stories like mine should not happen anywhere, but certainly not in our country. Our healthcare system is broken. It's time we look to single-payer healthcare as a way of ensuring that families aren't faced with impossible choices like mine.
Kamala Harris, meanwhile, made a fiscal argument, targeting her remarks at skeptics who are going to say, well, we can't afford this. We don't have the money for this. Why are we doing this now?
And let's be clear, it is not only about what is the right thing to do morally and ethically. It's also smart in terms of the fiscal impact. Public health model tells us so well. You want to deal with an epidemic? Smartest, most effective, and cheapest way to deal with it is prevention first. If we're dealing with it in terms of early intervention, and certainly if we're dealing with it in the emergency room, it's too late and it's too expensive. Let's give the taxpayers of the United States a better return on their investment.
A doctor from Canada showed up to tell everybody that, look, this actually isn't that hard to do.
In public polls, 94% of Canadians say that our healthcare system is a source of personal and collective pride, even more than ice hockey. Single-payer healthcare is a symbol to us of what it truly means to be Canadian, that we take care of each other. My generation of Canadians does not remember what it was like to worry about paying a doctor or a hospital bill. And despite our challenges, which of course every country experiences, Canadians have a longer life expectancy, lower infant mortality rates, and fewer preventable deaths than in the United States. We spend just under $5,000 per capita in Canada to cover everyone. You spend nearly $10,000 per capita, and yet tens of millions of people are uninsured.
I love my northern neighbor, but it is embarrassing to me to have a Canadian stand here in the capital of the United States of America and talk about a system that takes care of their children better than we take care of our children.
Now let us be honest. The crisis we are discussing today is not really about healthcare. Crisis we are discussing today is a political crisis which speaks to the incredible power of the insurance companies, the drug companies, and all those who make billions of dollars off of the current system. Over the years, these entities have done everything that they possibly can to prevent us from having lower-priced prescription drugs and universal health care. As one example, hear this. Since 1998, the pharmaceutical industry alone has spent over $3.6 billion in lobbying and hundreds of millions of dollars more in campaign contributions.